First and foremost, our thoughts with the President and the First Lady. If we can start there, and if you can update us on the health of the President, when you last spoke to him, what he sounded like, what you're hearing now.
I spoke to him last evening. Sounded fine. I didn't get to see him, but I did speak to him. I have not spoken to him this morning. Chief Meadows has spoken to him several times. We're all getting our assignments. Apparently, it's a light version of the virus. Let us pray that that is the case. Pray for both the President and the First Lady, and my pal Hope Hicks, and Ronna McDaniel, for that matter. So we're okay. I was tested this morning. Thankfully, it was another negative test. I think I'm 86 or 87 straight days, something like that. And business is functioning here in the government, and we hope the President gets well very soon.
We share those hopes, Larry. If you can just describe for us the symptoms with a little bit of detail so we can get a little bit more clarity. You called it a light version of the virus. We've heard it described as mild symptoms. What are the symptoms, Larry?
I'm just not in position to tell you, Jonathan. As I said, I have not seen him. I've not talked to Dr. Connolly, so I'm not the guy on that particular beat.
I understand that. I think some way you can help us, though, is the process. What we're experiencing right now in the last 24 hours is probably the most high-profile track and trace process that's played out since the coronavirus started. When were you contacted, Larry?
Contacted about the President.
Contacted about Hope Hicks testing positive and that you would have to go and get a test yourself.
Yes. Well, I get one every day, as a matter of course. People that come in and out of the Oval and are with the President, there's a bunch of us that get tested every day. I heard about Hope last evening, and I heard about the President as soon as I woke up this morning.
What we've learned from the White House Chief of Staff, Mark Meadows, is that the White House knew that Hope Hicks had tested positive ahead of leaving for the New Jersey fundraiser. And, Larry, I think a lot of people are asking questions as to why the President still went to Bedminster, New Jersey, when the White House was aware that Hope Hicks had tested positive. Can you give us any clarity on that, shine a light on why, Larry?
I'm not sure, Jonathan, I can. I mean, I wasn't on Marine One. I didn't go on that particular trip. I think that as soon as they realized what happened, they took certainly distancing measures. But, look, I wasn't there. I'm not the doctor. I'm here to talk about the better-than-expected jobs report and why the economy is doing well. I can't help you on the medical stuff. If I could, I would, but I wasn't a participant.
Totally understand.
And I wasn't there.
Larry, don't expect you to talk about the medical stuff with us today, but you have in the past voluntarily suggested to Americans how they should act and engage with each other. And I just wonder, for everyday Americans right now, what kind of message this sends? And you are representing the administration at the moment, Larry. What do you think this sends as a message to the public in America right now?
Look, we continue to emphasize the protocols. That is to say, masking and distancing and testing where applicable and good daily hygiene, washing your hands and your face and so forth. We have said this throughout the pandemic, and we will say it again. And I think we all are observing the protocols as best we can. Especially the distancing, but also, look, when I go out of the complex, I'm wearing a mask. I couldn't get into a store if I didn't have a mask on. And we're all very conscious of this. This is big. Listen, this is terribly important stuff. I understand that. And lives are at stake, and it's difficult. But, again, our protocols have not changed. Masking, distancing, testing, and good hygiene. That's the best you can do. We have improved on the therapies. The doctors know a lot more than they did. Dr. Sean Connolly is the best in the business. The White House medical unit is the best in the business. The President's going to get absolutely first-rate plus treatment. And as I said, we all pray for him and the First Lady.
Why weren't those protocols followed yesterday?
I don't know that they weren't.
Well, it's quite clear from the timeline that we've already discussed, and the White House Chief of Staff, Mark Meadows, basically confirmed they were. If you'd learned before the trip that an aide to the President, Hope Hicks, had tested positive before leaving and you still left and then went to a fundraiser, they're the protocols. They haven't been followed, Larry.
Jonathan, I just can't speak to it. As I said, I wasn't there. I have spoken to the chief this morning on some other matters. We didn't go through that timeline. I'm sorry. I just can't speak to it.
Now, I understand it puts you in an awkward situation, but I think at the moment for the American people, they've had to follow the guidelines, and it's pretty clear in the last 24 hours from what we've heard, Larry, that it doesn't sound like the president did. So for Americans at work today, engaging with the workforce that may have been exposed to coronavirus and might have to return from work without pay and go and self-isolate, how do you convince them that that's the right thing they should do? And that's an economic question.
Yes, it is. Now, look, we continue to emphasize the protocols. As you and I have talked about this, you know, you see virus hotspots, for example, and we have mitigation to control it. Fortunately, the trends look pretty good right now. Hospitalization, fatalities way down. Cases popped up a little bit earlier in September. They're coming back down. But all through this, to the best of my ability and the best of everybody's ability, we have emphasized these protocols. We must do this. Now, it can be done. It does seem to work. And we're open business. I guess we've got about 80% of our business open. And, you know, we are assisting medically and financially to help people deal with COVID issues, you know, renovations if necessary. We're testing. I think we're at 1 million tests per day now with a capacity to do even better. But again, proper masking, proper distancing, proper testing, and proper hygiene, that has been a staple of our response from day one.